this last session then I want to talk a little bit more in detail about what critical appraisal is actually involving. Again, there's quite a lot of material available on the internet in this area, and critical appraisal is really the process of systematically examining research evidence to assess its validity, results, and relevance before using it to inform a decision. So it's about either within a systematic review, looking at the individual studies and deciding which of these studies are more or less valid in terms of their methods, looking at their actual results, and then how should those results impact on the conclusions that the systematic review comes to. Within guideline development, then, it's going to be more broad. It'll be looking at the results of systematic reviews, of studies, of the variety of literature that will be uncovered in the initial searching part, and then trying to examine the results that will come from that. It could be that there could be different recommendations and different guidelines from different years, different parts of the world. How are you going to examine their results and weigh them all up? And then which of these are going to be the most relevant to the Irish setting, the most relevant to the patient population that you're addressing, or the other dimensions of the unique question you're looking at within your guideline. As an example of the importance of appraising the systematic reviews themselves, I just took this particular example that came up in one of the books looking at systematic reviews, but it points out two different systematic reviews were published in 1992, looking at a question at that time about whether low molecular weight heparins, a newer form of making heparin, had better outcomes in preventing thrombosis after surgery compared to the standard heparin that was being used at the time. One of the reviews gives you a nice, clear conclusion. Low molecular weight heparins seem to have a higher benefit to risk ratio than the traditional heparin. And then, of course, another review comes along and unfortunately says there's no convincing evidence that general surgery patients do any better with these low molecular weights. So what's the issue here? Is it that nobody knows? Is it that there's biases are creeping in here? And this is where, when you look at the details of the two systematic reviews, you can start to see at least why they came to different conclusions. Maybe not exactly which one you're going to rely on, but at least you can start to understand it's not that systematic reviewing is a waste of time, it's that some people held to the kind of standards in some places and not others. So when you compare the two systematic reviews, very similar years, the question, did they look at unpublished literature? These guys did, these guys didn't. These guys held no restrictions to the languages that were going to be used, whereas in this one they restricted it to English, German, and French publications. So this review then is going to be more limited in terms of the studies that it's going to find, whereas this will find a lot more. They both accepted all types at the time of thrombosis detection. These guys actually added in ultrasound at the time, which was only starting to be used more regularly in this area. Did they assess the quality of the studies? So we're thinking these guys are really good. They've gone out, they've looked for everything, but they also haven't looked at the quality of the studies. So their conclusions are not going to, not only will they have more studies in there, they are not going to actually tell us anything about which of the studies were of high quality and which were low, whereas the other review is starting to look a little bit more positive now because they actually did rank the studies on an 8-point scale. So then in the analysis, as you'd expect, these guys found more studies, involved more patients. This is the method of doing meta-analysis, which is the same. There's two common methods used, and that's both fine. And then since they didn't evaluate the quality, there was no way for them to rank the results by quality, whereas these guys did. And overall, you end up with the two different conclusions. So the point is that it's not easy to say, well, which of them should I rely on? That in fact, both of them have strengths and weaknesses. And this is part of what is going to be the challenge when you've got all of your material collected from the systematic review, that you'll be left with things like this, where some of them will be strong in some ways and others will be strong in different ways. And this is where there is judgment involved in developing, well, in doing a systematic review and then in developing clinical guidelines. And this is the challenge then that you have to understand why there may be differences in the results and the conclusions, and then also how are you going to translate that into the types of recommendations that are going to be most appropriate for your population, for your question that you're addressing. And critical appraisal then is really about going back to the steps that are involved in a systematic review and asking about whether they did the best that they could at each of these stages. So again, you have to understand the steps of the systematic review in order to be able to critically appraise it well. So you've to look at the question that they come up with, and you, maybe from your clinical practice, will realize, that's a nice theoretical question, but that's not what we're really grappling with in the clinic. I know, for example, in one question, a family member of mine was trying to make a decision about treatment, and what we really wanted to know was the long-term benefits or limitations of this treatment. What's survival like 5 years, 10 years down the road? But in talking with the consultant, she had to tell us, I'm afraid the studies are not going out that far. They're all going out to 3 and 4 years. And unfortunately, nobody knows, or there isn't as much evidence to guide us on the long-term benefits. And so this is where, going all the way back to the question that the researchers are initially posing, they should be influenced by the fact that patients and clinicians want to know 5 and 10-year outcomes and use that to influence their original studies. And likewise, a systematic reviewer should be determining, well, maybe there's fewer results out there on 10-year survival, but we're going to go look for those. We're not just going to cut it off at 3 years or 5 years because that's more convenient or easier. And so this is where the clinical input and the patient input is really vital to ensuring that the systematic review is actually addressing the real practical questions. So again, at all of these different stages, there are going to be things you can ask about. So in collecting the data, did they actually pull all the relevant data out of the original studies? Maybe they'd only focused on quantitative data, but there actually was really important qualitative data collected as well on quality of life of patients. And for some reason, they decided not to include that. But if you identify that it wasn't done, you still may be able to actually go back and look at the original studies. And if that's a key component of your guideline, you can start, it'll take a bit more work, but you can start to see, well, actually, we can dig into those original studies and be able to give better guidance ourselves, even if the reviewers haven't done that. So, based on the steps of the process, this is just one particular set of questions to ask about a systematic review to be able to appraise whether or not it's of really high quality and can be readily relied upon. So obvious questions, again, once you think about the process of systematic reviewing. Is the question clearly focused? In this particular approach that we developed, we simply had yes, no, or unclear types of answers. And if a systematic review had lots of no's in it, then we would lower the priority that we would give to how we would base our overall conclusions on that particular systematic review. Did they include the right type of study? Again, going back to if it's an intervention question or a diagnostic question or an economic question, you have to look at the different types of studies that are most relevant. Then getting into the methods, did they identify all the relevant studies? And you saw in that one review a few minutes ago, one of them was strong in that area and the other one was weak. And you'll see this in many cases. We were looking recently with some students at a systematic review that we found, and these reviewers decided they were not only going to limit it to English language, to studies published after 2000, they also only wanted studies published in the US for some reason. And so all of this makes for an easier review, a nice shorter, more concise review. But the problem is you miss out on all of the other evidence that can impact on the final conclusion. So did they assess the quality of the included studies? And that should be done clearly. If the results were combined, if they made a meta-analysis, was it reasonable to do so? And if they do a meta-analysis, they should always report what's called a heterogeneity. There's a few different statistical tests that can be done within the meta-analysis process, and this will actually give you a numerical value for the degree of heterogeneity. And there are it's not a black and white type of cutoff number, but it'll give you a sense. These studies are actually relatively similar. It's legitimate to combine them, or it may say, actually, these studies are so unlike one another, they should never have done a meta-analysis in the first place. And that then should impact how you use those results. Then getting more into what the review finds. If in the first 5 questions, it's all no, they didn't do that, they didn't do this, they didn't do the other thing, you probably could reach the point of saying, well, I'm not even going to bother trying to understand their results because their methods were so poor, it's not really legitimate to base much of the conclusion on all of this. But if the quality is acceptable, then you start to ask these types of questions. What are the results? How precisely were they presented? Did they provide confidence intervals, statistical significance testing? All of those types of detailed answers so that you can start to see, well, actually, what they found was a difference of 0.01, which may statistically produce a significant result. But among patients, if you're asking them, is your pain level 0.01 degree better than another, then that's not actually going to make much difference to an ordinary patient's experience. And so you start to evaluate the clinical significance of those results. So that's starting to get into the question about whether your population that you're interested in, are they actually, is the review done on a group that is either maybe identical to yours, or are there significant differences, so that the review may be excellent, but it's done on a group that for whatever reason is so different to your group of interest that you really can't use the results with your people of interest. Again, did they look at all the important outcomes? And this is where you may decide, well, the systematic review is giving us really good answers on the outcomes and the pain levels, but it's not telling us anything about the economic outcomes, and we're going to have to look somewhere else if we want to try and address that question. And then the hardest question is, how is this actually then going to make an impact on policy or practice? And again, you're into an area where you're making a judgment, hopefully an informed judgment, but are these results strong enough for you to say we ought to introduce this type of policy, or should we have it where, depending on certain factors, this would be the better approach to take, but with other factors it's really not. There's going to be this sense of just how clear are the results to actually lead us to call for various types of recommendations. And in doing this in the guidelines, this is where you may come up with strengths of recommendations, where you're saying there is clear and strong evidence that this type of thing should be brought in, but in this other area the evidence is much weaker, and therefore we can't mandate this, but we seem to, or the evidence is leading us in a certain direction as opposed to being very clear and convincing. So with critical appraisal then, all studies have the potential for introducing systematic bias, and so this is what we're trying to avoid. So we need to understand the study design, we need to see how well it's been carried out, and then the critical appraisal process is the key to doing all of that. Another aspect with all of this is that you don't want to do a systematic review and find actually there's no evidence that on this topic that we really wanted it. And yet, in some ways, finding that there's no evidence is actually useful. It may not be, or it won't be helpful in terms of developing guidelines, but it will help in terms of then allowing you to say, we really need more research to be done on this particular topic, or there's a lot of research in this area that's been done with male patients, but women are also getting treated with this drug or are also experiencing this condition. We need to encourage more research that targets whoever isn't getting the focus. Or it may be that we need guidelines on this particular topic, but there just isn't the evidence to base them on at the moment, so we need more evidence to start to provide that, or more research to provide that type of evidence. So I used one particular approach to critical appraisal worksheets that are available. Again, there are different worksheets available for different types of studies. So the consort statement is one that's been issued trying to improve the quality of reporting of controlled studies. And they have a worksheet available that will allow you to appraise the quality of controlled studies. For surveys, again, likewise, there's this one, the Strobe statement, available for that. And for qualitative studies as well, there's another appraisal sheet, so that regardless of the particular type of study, you can identify usually a reliable approach to evaluating it. So the other types of places that you may be able to find useful information, the Cochrane Library. This is the set of databases that the Cochrane collaboration produces, so that as new studies or new systematic reviews are being published by Cochrane, they're all put into the library. And again, Ireland has led the way in a number of initiatives within Cochrane, but we also were the first jurisdiction to make the library freely available to anybody on the island of Ireland. And this is something that allowed Cochrane to develop the technology to do that, to where it's now in many parts of the world now readily available. And through the WHO, it's also available in many developing countries where people may not be able to afford the subscriptions. Then there's the handbook that I mentioned earlier on, which gives you all sorts of details on the methods of systematic reviewing. So if you're kind of trying to understand the details of any particular review, you can go and look at the details there. And that will give you a lot of further information on critical appraisal as well, looking at risk of bias on different studies, defining the different types of studies. So it's a very good resource that again is freely available. And then what may actually be even more practical, the handbook is designed for people who are doing systematic reviews, but this is a new set of handouts that's been developed, which is basically condensing the handbook and saying what are the crucial things that need to be included in a really good systematic review on each of those 10 stages of a systematic review. So all of these are now available. They're kind of a set of standards for those producing systematic reviews, but I think they're very very nicely written so that if you're reading systematic reviews, you can just quickly refer to those and they'll say, here's the 4 or 5 key things that need to be there in terms of how well they searched for a systematic review, and you'll be able to quickly then see, well, these reviews have or have not done each of those different points. And then Cochrane Ireland is, it's a new initiative. It's about a year old now, and what it is that HRB has funded me for 2 days a week to try to develop more materials to assist people either producing Cochrane systematic reviews or using the reviews in practice or in your activity here of producing guidelines. And so as time goes on, we're hoping to really develop the materials that will be available there on our website. And as we develop various training programs, we'll also make those available through the website. And if you want to sign up for a newsletter that we're developing, just send an email to that address, and we'll get you included on that. So that concludes this section.